Akologo is going to be joining us in a bit, but we're going to be hearing as well from the Director General of the Ghana Health Service, Professor Samuel Kaba Akoriye, who spoke at the press conference earlier today. Take a look.
Take the opportunity to call on our sisters and brother nurses to come back to work. Just like yesterday, I said to one nurse that if you come to the hospital now, you as a nurse, and you are pregnant, you are going to deliver, because she was a pregnant nurse. What are you going to say? Will you say, I won't deliver today because we are on strike? You'll be shouting, let's all do this. Let's go back to the negotiation table. If it's your auntie, your mother who is sick, what are you going to do? Will you say, I won't take her to the hospital because we are on strike? And when you go to the hospital, who do you expect to take care of your mom or you yourself? So I humbly add my voice to the Honorable Minister that please come back to work and let's continue negotiating.
Well, so that's the appeal from the Director General of the Ghana Health Service there, but we'll be finding out whether this appeal has fallen on listening ears or otherwise. Samuel Akogo is the Vice President of the Ghana Registered Nurses and Midwives Association. He's joining us on Zoom. Austin Gama is a labor expert, is going to be joining us as well. But Mr. Akogo, appreciate your time. Thank you for joining us. First of all, let's establish this. We understand that there was this closed-door meeting earlier today between yourselves, as the Ghana Registered Nurses and Midwives Association, and the Minister of Health, and then also some major stakeholders in the health sector. What transpired at that meeting and how did it end?
Very much, Alfred, to you and your team, and then our cherished viewers and listeners. Yes, it is true. We're invited for a meeting this morning at the instance of the Fair Wages and Salaries Commission. And this meeting included all the chief executives of all the teaching hospitals, representation from Ministry of Finance, representation from Ministry of Labor, representation from Ministry of Health. It was hosted at the Ministry of Health Conference Hall. When we got the invitation, as you can recall, this process started about last week. We're thinking that at long last, the Ghanaian nurse and midwife will get a relief and be very active at work. Unfortunately, we got there, and the proposal from government was that, yes, indeed, they acknowledge the delay. They have also acknowledged that we deserve whatever that is contained in the document. But they have budgetary constraints. And for that matter, we have to hold on until 2026 for the conditions of service to be implemented. And this is where some of us now confirm our earlier belief that the employer had no intention of implementing our conditions of service, and that those series of meetings that they were engaging us on were just to pretend to be solving the problem when indeed they had no actual interest in dealing with the issue. As we speak now, all other health professionals in the other unions comprising of Ghana Medical Association, Health Services Workers Union, Physician Assistants Association, Certified Registered Nurses Association. We signed the conditions of service almost at the same time. DS was implemented, but ours, because of the court case that we had, it is impossible for the employers to say. Now, If they say we are essential workers and we are being treated like this, is it fair? And I have realized that sometimes when some of these actions, because the public don't know what is behind the scenes, sometimes they think we are being unfair to people of Ghana. But we are in a situation where me and my colleague, who is another health professional, is enjoying a certain conditions of service, which is also contained in mine. And mine, they say, okay, we have to wait. We table their their proposal. We also table a counter proposal, and we say, look, the challenge could be the arrears, because the document's implementation should have started in July 2024. But because of the court issue, it drags up to January. At least in December, we had resolved the court issue, and we applied for the and distributed all the stakeholders. And that is the obstacle that was restraining our employers from implementing the conditions of service. So that burden has been taken away. But unfortunately or fortunately on our part, that was the transition period in January. We initiated engagement with the then chief director, who was also communicating to the chief of staff, who was by then had been appointed already. And all this, we're doing this because we know it will have budgetary implications.
Right.
They cannot say that the 2024, that they were implementing the other health professionals' conditions of service, that of nurses was not catered for in the 2024 budget. It will be absurd for somebody to believe that the government would have selected those other unions and leave that of nurses and midwives. So members were putting pressure on us, and we kept on explaining. This is a new government that has come into power, and we have to give them time. Let them set the governance architecture. And based on that, we can see where we can ventilate some of these things. Minister was appointed, budget was read. So what is the problem? For us today, they told us that they could not capture it in the budget. The fact that the health professionals are enjoying some of the things that we are asking for makes it unacceptable for us to say, okay, we can, after even, unfortunately on our part, not getting anything from last year, up to this year, we are now being told that we have to wait until 2026. My brother, do you think this is fair? Do you think this is how they treat essential service providers?
Well,
what the government is just telling us, let me say employer, because we actually don't deal with governments. We deal with employers, and our employer is the Ministry of Health. The mandate to take care of the health of Ghanaians is in their hands. So if they feel we don't deserve this small token that we are asking for,
no, I'm going to
then we cannot be classified as essential service providers.
Right. I'm going to get